Hey there. So, if you've been diagnosed with osteoarthritis, you've almost certainly heard the phrase wear and tear. Well, today we're going to talk about why that's a really outdated way of thinking and what the modern science actually says about how you can manage your joint health. It's better news than you think. Let's dive in. Right off the bat, let's just get this out of the way. Your joints are not like old car parts, okay? This idea that they're just destined to wear out and there's nothing you can do about it. It's not just wrong, it's disempowering. It makes you feel like you've reached a dead end, when the reality is so much more hopeful. So yeah, it is absolutely time for a new story. We need to move past that old, creaky wear and tear myth because osteoarthritis is an active living process, which means you have way more power to influence how your joints feel and function than you've been led to believe. Maybe you've seen an X-ray report, one with scary-sounding words like degeneration or bone spurs, and it's so easy to look at that picture and think, well, that's it. That's the problem. But here's the thing. What if that image isn't even close to the whole story? This is where the science gets really, really interesting. Study after study has shown that what we see on an MRI or an X-ray often has very little to do with how a person actually feels or what they can do. I'll say it again. Your X-ray is not your destiny. To figure this out, scientists did something pretty brilliant. They took huge groups of people, thousands of them, who had absolutely zero pain, no stiffness, nothing, and they scanned their joints just to see what was going on inside. And what they found? Well, it changed everything. Okay, just look at these numbers for a second. This is mind-blowing stuff. For people over 40 who had no pain, 43% had cartilage changes. Nearly 20% had meniscus tears, and 37% had bone spurs. These are the exact things that get blamed for osteoarthritis pain, and yet, all these people felt totally fine. Let's just focus on that one number for a second. 43%. Almost half of all people over 40 walking around with zero knee pain have what would be called arthritic changes on their MRI. This isn't some rare finding. It's completely, totally normal. So what's the big takeaway here? It's that these changes we see on a scan, they're a lot like getting gray hair or wrinkles. They are a normal part of aging. They do not automatically equal pain, and they are not a life sentence saying your joint is broken. So if the X-ray isn't telling the whole story, then what is driving the symptoms? Well, it turns out that osteoarthritis pain is influenced by a whole bunch of interconnected factors all over your body. And that, my friends, is great news because it means there are so many more things we can do to help. It's a whole body thing. We're talking about things like how strong your muscles are, how well your joint actually moves, your body's overall level of inflammation, even how sensitive your nervous system has become to pain signals. It's all connected. And that nervous system piece, it's a huge deal. Sometimes, especially with long-term pain, the body's alarm system gets a little overprotective. It's a state we call central sensitization. The analogy here is perfect. It's like a smoke alarm that's so sensitive it goes off for a piece of burnt toast, not just a real fire. The great news, we can absolutely work on turning that sensitivity down. Okay, so we know what's really going on, but what do we do about it? Let's talk about the how. Because modern osteoarthritis care isn't about just sitting back and waiting. It's about grabbing some powerful, active tools and taking back control. And these are your big three. These are the absolute non-negotiable foundations of any good management plan. Number one, education. Just understanding this stuff, what you're learning right now, is a treatment. Number two, exercise therapy. This is the single most important thing you can do. And number three, managing weight and body composition to reduce both the load on the joint and that systemic inflammation. Now, let's clear up a huge fear right away. So many people think, if I exercise, I'm going to cause more damage, more wear and tear. But the science is crystal clear. That is a myth. The right kind of exercise is safe, and what's more, your joints actually need movement to get their nutrition and stay healthy. Not moving is often worse. And when we talk about exercise, we're not just talking about one single thing. A good balanced program has a few key ingredients. You need strengthening to support the joint, aerobic activity for your overall health, plus flexibility and balance work to help you move better and more confidently. It's the whole package. So what about other things like hands-on therapy, massage, or even bracing? Well, they can definitely be helpful, but think of them as the support crew. They're there to help your core plan, the education, exercise, and weight management, succeed. They can reduce pain and improve movement, making it easier for you to get back to being active. So, how do we put this all together into a plan that actually works for you? Since everyone's body and experience with osteoarthritis is unique, a cookie cutter approach just doesn't work. A personalized plan is absolutely essential, and that all starts with a really thorough evaluation. A good clinician is going to look way beyond that x ray. We want to know your story, your goals. We'll look at how your joint is actually moving, test your muscle strength, and see how you do basic things like walking or squatting. This detailed, hands-on exam is what lets us build a plan that targets the real drivers of your specific symptoms. And listen, it's important to remember that this is a journey, not an overnight fix. The first few weeks are all about calming things down, learning the ropes, and starting with gentle movement. Then we start to build up strength and get you back to doing the things you love. The ultimate goal here is to give you the tools and the confidence to manage this yourself for the long run. So if you take just one thing away today, let it be this shift in perspective. You're moving from an old, passive story of wear and tear to a new, empowered one where you are in control. Your x-ray isn't your destiny. How you function is. And movement isn't harmful. Movement is medicine. With this new way of looking at things, the power is truly back in your hands. You are not defined by an image on a screen. You have the tools to actively manage this and live a full, amazing life. So the only real question left is, what's the first step you're going to take?